So I'm just going to discuss a few simple cases that have had intervention through our office. The first case is a female airline attendant. She had prior surgery in 2022 elsewhere, and then she had multiple surgical interventions as well as steroid injection, and finally she had an open surgery. The finding was always that there's evidence of a vocal fold scar on the left side, and she found the voice was too weak and rough for her work. So she came here for a second opinion, and we proceeded to do a platelet rich plasma infusion on her at the end of last year in December through January 2024. So here's the voice before. And what you can hear is a bit of a rough voice with a gap on the left side. And she's not able to get very loud. And that's a low voice. So she had the procedure in the office, 3 separate injections. And here is after. This is actual during the procedure. You can see a little bit of the blood in the throat area.
The cake is great.
So this is after.
The rainbow is beautiful.
Do a pitch glide, go ooh. Very good. And say
And you can see much better closure.
Good. Same note. And build to a swell. Good. We're done. All right, we got our fingers crossed for you that the fat will last forever.
Here's the second case. This is a classical singer, and he's a male. He's both a teacher and performer. So he had surgery several years ago, and after the surgery for facial fractures, he couldn't sing. On my examination, I thought he had a vocal cord scar, and the voice was just not improving with therapy. So here he is. And what you can hear and see is the breaks in the voice with the cracking of the voice. He's still teaching, but he's not able to sing well. So this is the injection. And here he is after. And you can see the better closure. And this is 4 months after.
What can you do now that you couldn't before we did the injection?
I could not sing above a middle C.
Go ahead and do a pitch glide.
Okay, so that gives 2 sample cases of what we can do with the platelet-rich plasma, and hopefully that will be helpful to those of you that are considering intervention using this approach.